Welcome to the University of South Carolina Big Data Health Science Conference. My name is Xiaoming Lee. I'm professor in health promotion, education, and behavior, also South Carolina Smart State Indoor Chair for Clinical and Translational Research in the Arnold School of Public Health at the university. So Dr. Banky Alatosi and I co-directed the USC Big Data Health Science Center. It's my great pleasure and honor to introduce Dr. Steve Cutler, Interim Executive Vice President for Academic Affairs and the Provost for University of South Carolina. Dr. Cutler has been a pharmacy educator for more than 30 years, working at the School of Pharmacy at Ohio Northern University, Mercer University, the University of Mississippi, and the University of South Carolina. He received 10 teaching awards and recognitions from various classes of students. Dr. Cutler is a broadly trained natural products medicinal chemist and behavioral pharmacologist. His research focuses on the isolation of natural products, design of new needs, synthesis of biologically active derivative, and the discovery and the development of drugs to treat various disorders, including those of the central nervous system, CNS. He is a world expert on plants acting on the CNS, including marijuana and other psychotropic plants. His work is also centered around addiction. During his career, Dr. Cutler has received more than $36 million from various federal agencies, including NIH, NSF, DOD, CDC, NASA, and the USDA. He is the author or co-author of 50 US and international patents, 135 peer-reviewed publications, 3 books, 21 book chapters, 40 published abstracts, and more than 200 scientific presentations. Before being appointed as the USC's interim executive vice president and the provost in May 2021, he served as the dean of College of Pharmacy since 2016. Under Dr. Cutler's leadership, the College of Pharmacy played an integral role in the university's response to the COVID-19 pandemic. The college was one of the first in the nation to develop and gain federal approval for saliva-based COVID-19 testing for students, faculty, and staff. Its on-campus testing program, lately extended to colleges and universities throughout the state, greatly increased University of South Carolina's testing capacity, complementing and supporting the successful testing and the tracking efforts of USC's health services. Provost Cutler is also the mastermind and the chief architect for the University of South Carolina Excellency Initiatives, under which the Big Data Health Science Center is funded and supported. Let's welcome Provost Steve Cutler to deliver his opening remark for the conference.
Thank you, Dr. Xiaoming Lee. What a generous introduction, more than I deserve. And I'm very, very grateful for that. I want to welcome each of you to the 3rd annual National Big Data Health Science Conference. And for those of you who joined us last year, I think you will say it was a remarkable event. As we entered into COVID, we began having more of our conferences held virtually in a manner much like we're going to see today. And the work and effort by Miranda Cole was phenomenal. She did an outstanding job. So for those of you who didn't attend last year's conference, you're going to enjoy this year's conference because it's going to be done in a way that you've not experienced as we talk about virtual conferences. This year's theme for our conference is Unlocking the Power of Big Data in Health, Developing an Interdisciplinary Response for Health Equity. And COVID-19 will be a focal point for many of the sessions. We'll hear from experts about their creative approaches for using big data to combat the pandemic in a variety of ways. And what we'll see is that this will serve our healthcare system as we go forward, because a lot of the initiatives and a lot of the ideas that have been developed over the past year are going to be useful in other areas of healthcare. We're so proud to host speakers and guests from around the world. Our speakers and presenters come from over 19 different universities and organizations, countries such as India, China, and Switzerland. And they include leading experts from places like the National Institutes of Health, as well as South Carolina's Department of Health, and other government, academic, and industry experts and healthcare organizations will be participating in this conference. For the third year in a row, we're very lucky to have Dr. Susan Gaguric from the National Institutes of Health. She is the Associate Director for Data Science and Director of the Office of Data Science Strategy. Also, we're very fortunate to have 3 in-state leaders and experts that will serve as keynote speakers. Dr. Linda Bell, our South Carolina State epidemiologist. Dr. Windsor Westbrook Sherrill, she's Associate Vice President for Health Research at Clemson University. And Dr. Anthony Giuseppe-Elli, Dean of the College of Engineering at Anderson University. This conference is going to host 7 keynote speakers presenting on a range of big data related topics, such as leveraging partnerships and collaboration, and using artificial intelligence and knowledge graphs for precision medicine at scale. In addition, 6 in-depth breakout sessions are hosted by the Big Data Health Science Center. Cores will share their innovative work being done by a total of 37 different speakers. In addition to the breakout session, attendees have the option to attend 3 hands-on workshops in areas like SASVIA or computational modeling. And I encourage you to use the interactive networking features offered by the app, and to attend those poster halls with those posters that are going to highlight areas ranging from artificial intelligence to electronic health records. And in the spirit of its theme, this conference will provide a robust look into how we can use big data to improve care, prevention, and health equity in South Carolina, the nation, and around the world. So please join me and enjoy this tremendous conference and this tremendous opportunity to learn from some of the best and brightest in big data. I thank you for joining us, and I will hand it over to Dr. Olastai, who will lead us in the next session. Thank you, Doctor, and thank you, Xiaoming Lee and Miranda Cole. Excellent job. Thank you.
Thank you.
Thank you, Dr. Koppler. I'm Dan Kieltosi. I'm co-lead the Big Data Health Science Center with Xiaoming Lee. It is my pleasure to introduce you to this session, part of the session where we recognize our case competition participants. So prior to the conference, February 4th through 6th, which was last weekend, we had over 17 teams from across the nation join together to battle to become champions of the Big Data Health Science competition. They consisted of enthusiastic teams of graduate and undergraduate students, and they were able to use their skill sets in data analytics to solve this year's challenge. This year's challenge focused on solving inappropriate hospitalizations using a data science and analytic approach. Each participating team got the data and analyzed the case using their skill sets. They looked at the International Statistical Classification of Diseases, codes for ambulatory care sensitive conditions to find an algorithm that would help reduce inappropriate hospitalizations in our hospitals. They were provided 5 years of data, 2016 to 2020, and each team was given 24 hours to devise a solution for the case. The first round began February 5th at about 12 noon, and the finals ended in the early afternoon of Sunday, February 6th. The students and the teams were worked really hard late into the night. Some didn't get a lot of sleep, but they were able to provide outstanding algorithms to the case competition judges. Our judges panel this year, like every other year, came from both academia, from the government, and from the industry. And with that, I'd like to make some recognitions. We want to thank SAS Institute for being part sponsors of this competition. We also want to recognize and thank the South Carolina Office of Revenue and Fiscal Affairs for providing us the data to actually curate and prepare for the team. Each team's presentation was judged by a panel of 3 to 7 of those judges. After the preliminary rounds and the final rounds, 5 teams advanced, and we have the top 3 teams presenting today. So it's my privilege to welcome the winners of this year's case competition.
Hello.
Hi, everybody.
Hello. Hi, everybody.
Hi there. Hi, everyone.
Hello.
We had the pleasure of competing in this year's Big Data Science Health Competition.
My name is Vivek Socrates.
This is Yaroslav.
And I'm a PhD student at Yale University.
It was a great experience that allowed us not only to work with real-world data, but also step outside of our comfort zone and work within a new domain of healthcare.
I learned quite a bit throughout this competition, in particular, a little bit more about how to pre-process and clean clinical data. However, the most important thing that I learned was how to effectively draw insights from this data and communicate recommendations to a panel of experts.
And during the competition, I was very thrilled to witness the level of engagement both from the organizers and the participants. It was very clear that a lot of thought had gone into making this a meaningful learning experience.
I look forward to taking the skills that I learned in this competition and better deriving insights using clinical data and improving patient care. Thank you.
My name is Hua Vo.
My name is Lindy Lutzow.
My name is Josh Carlton.
So as a team, we really tried to hone in on the root cause of the problem at hand, which involved inappropriate hospital admissions. We attempted to marry our innovative technical analysis with real-world applicability.
So our team got a point with the exclamation point. We came to the second place of this competitions.
And we very much enjoyed this year's competition.
My name is Max Griffin.
My name is Kalbi Abbas.
And I'm Srishti Srivastav.
And we are the team from Oklahoma State University. And we were able to come out on top. Very exciting. We learned a ton about not only how to handle big data, but also a little bit about ourselves.
I would also like to add on to that, the fact that the competition had a time pressure on it, just to think about how you want to assign our resources and time to which kind of problems you want to solve, which actually simulates very much the real world scenarios. And that's actually really helpful and was a great learning experience.
We learned a lot during while working on this thing, delivering work within the defined timelines and working for like 2 days straight without sleep. So it was all very, very exciting.
I would like to say thank you to the organizers.
Thank all of the coordinators,
participants,
judges,
the volunteers,
and other teams for putting together such a great program.
The competition was a lot of fun.
It was a great pleasure to participate in this competition.
Yes, thank you very much. Go folks.
Thank you. Enjoy the rest of the conference. Go Pokes.
Thank you and congratulations again to the winners of the competition. But everyone who participated in the competition itself was a winner. So we recognize each team that participated in the competition, as well as the organizers and the volunteers that spent hours this past weekend to do that. We encourage you to look forward to sending a team to us next year at the next year's Big Data Health Science case competitions for students. I assure you it's going to be fun, just like you've seen today. We will now be transitioning to our plan for our next session, which will begin at 9:20 a.m. Again, get ready to have a conference that is packed with a lot of fantastic information and data science fun. We will see you shortly.